You are watching the DocTalk show.
Welcome back. We are discussing prostate enlargement, a condition that is very common in aging males. It occurs by virtue of the prostate. As you grow old, your prostate gland gradually increases in size due to the effects or response to a male hormone called testosterone. Problems arise when the prostate gradually increases in size. It obstructs the flow of urine, and that will cause so many urine symptoms such as feeling the need to go to the toilet always, or going for a short call very often than usual. And these can be very significant distressing symptoms to the man, especially an elderly man. It can be potentially embarrassing if someone has to run to the toilet always. So I'm in the studio with Dr. Mohan, who is an experienced urologist. He has studied a lot about prostate disease, and he's going to tell us more about what they do when they receive such a patient, how well they can help such patients.
When you receive such a patient, yes, the first step is a detailed history.
To take a history.
Detailed history. How often are you going? How has your urinary habits altered in the recent past? How much of sleep is disturbed? And how poor is your flow? Now, once you have taken a detailed history and you have arrived at a possibility of a benign prostate enlargement in an aging male, the next step is to do 4 basic investigations. The first and foremost is to get a uroflowmetry, that is to measure the speed at which they pass urine. The second is the ultrasound of the prostate and the post-void residual urine, that is the amount of urine staying in the bladder after you have passed urine. The third is a serum PSA. It should be less than 4. More than 4, the possibility of cancer prostate has to be considered. All this tests have to be done, as well as a digital rectal examination of the prostate per rectally by the urologist. This would constitute the basic tests to evaluate the prostate.
Okay, so let us understand more in detail about each of these tests. The first one you mentioned was a uroflowmeter of the prostate gland. In simple terms, what does it mean?
It's a very simple test. Yes. You basically go to the bathroom. There is a device fitted to the urinal, the commode of the urinal. As you pass urine, you cut a light beam, and when you cut the light beam, the force at which and the volume at which you passed urine is graphically sent to a printer, which gives a printout.
So it's a special room which has
any bathroom in the hospital. You can fit this simple device.
Okay.
So it has got a cup through which you pass urine. And as you pass urine through this cup, it measures the speed and volume of urination.
Speed and volume.
Of the urination.
So it will detect if there are changes in whether the urine
flow
volume is coming very well.
If it is at one stretch, or they do it in multiple stretches, the force at which it is passing, how long do they take to empty the urine, all this can be measured.
And all that information can be measured and recorded on a graph.
Absolutely. Normally a young person makes 25 ml per second.
25
milliliters
of
ml of urine per second.
Okay, so that is the speed of
urination.
Okay.
And he generally completes his void in 10 to 15 seconds. The void may be anywhere between 200 and 400 ml.
Okay.
Now
that is a normal
normal adult male.
Within 15 seconds he should be done with
15 to 20 seconds he must be done with the act.
Okay.
If now the flow is half of what it should be, say 12 ml per second.
That is in which type of people?
In people age greater than 45.
The volume tends to decrease.
The speed at which they pass urine tends to decrease, and the ability to pass at one go disappears. They pass it in staccato pattern. They pass interrupted. They take breath because they're using the abdominal muscles to help the bladder to pass urine. They hold their breath. So when they breathe, the flow stops. So you get a staccato pattern, or we call it a AK-47 pattern.
AK-47.
Tuk, tuk, tuk,
Okay, so it just means the urination has
breaks, frequent breaks, and then they finish the void. That is called a staccato pattern, or what we call as a creeper, or a pattern which hugs the baseline, where the flow is less than 4 or 5 mils per second. So these indicate obstruction to the flow.
Okay, the interrupted pattern
and the low flow pattern
very low flow.
indicates, and they'll take more than 45 seconds to empty the bladder. This indicates obstruction to the flow, indirectly telling us there's a mechanical obstruction in the outflow of urine. Other than stricture urethra, it's only the prostate enlargement that can cause this kind of a problem. Now, stricture urethra has a typical square pattern, so which will allow us to guess, as well as the age group in which stricture presents is a different age group, younger age group. So we get to know the way forward.
Okay, so you get there's a way you can interpret from the graphs.
Yes, of what to do next.
What type of disease.
Yes. For example, if the flow is more than 20 mils per second, you know this is not an obstructed system.
It is a normal.
Yeah, it's a normal. So maybe the sugars are high. That's why he's passing urine frequently. Or he is on a diuretic medication. That's the reason he's passing frequently. Or he's constipated. So we can look for other reasons. But if there is mechanical obstruction, then we look at the ultrasound. We'll see the size of the prostate. Normally, it's 15 grams at puberty, 25 grams by age 40. Now, if you see a large prostate, or you see a reasonable prostate, say 40 grams, but a significant amount of urine is staying back in the bladder, say 30%.
So this is the second test.
Second test. After the uroflow, the ultrasound.
Okay, then you do the ultrasounds.
Correct. And in that you see the size of the prostate and the amount of urine staying in the bladder after passing urine. If it is more than 30% of the void, you pass 100 cc and more than 30 cc is left behind, then we know the mechanical obstruction is hydrodynamically significant. It is not allowing the gentleman to empty all his urine. So the urine that stays back in the blood keeps irritating the mind, go to the bathroom, go to the bathroom.
Oh, it is that residual urine
which irritates and causes frequency.
Urine bladder. So that's what causes the urge that you must.
You should go often to pass urine, because it keeps telling the mind that there is still urine
urine to be
the
passed
bladder.
out. And so the scan can tell us that
those two
inputs is big
and amount of urine staying back in the bladder, which we call as post-void residual urine.
Okay.
And the third test is a PSA. It should be below 4. If it is below 4,
the PSA, people may not understand that PSA.
PSA is a blood test. If the value is below 4 and the prostate is enlarged, it's because of age. If it is more than 4, it could be because of cancer prostate. Cancer prostate doesn't have any other distinctive symptoms. If it is more than 4, we'll have to go looking for the cancer prostate. If it is below 4, a combination of uroflow, an ultrasound and a serum PSA. Then we do a digital rectal exam. The reason we don't do the digital exam early is if you put a finger and you massage the prostate, the PSA may go up. So it may indirectly give you a wrong report of elevated PSA.
So more about this PSA test. Like you said, it's a blood test. It's an abbreviation, but in full
it's a prostate-specific antigen measured in the blood.
Okay, so it seems to be elevated in what types of conditions?
It is either be elevated in cancer, it could be elevated because of infection of the prostate such as prostatitis, or it could be elevated marginally, say a 6 or a 7 value in a very large prostate.
In a large prostate. So it is it's like a natural substance produced by the prostate that can be detected in blood.
Correct.
Okay.
You are watching the DocTalk Show.